Well, the economic reality for Americans living where business is generally open is vastly different from those living where things are mostly closed. States and cities are rebounding differently as local governments balance the COVID surges with the economic impact of putting further restrictions in place. Bloomberg U.S. economy reporter Olivia Rockman joins me now. Olivia, it's great to have you back on the show. How are different regions being affected? Are there sort of geographic trends that we're starting to see?
Hi, Tim. Thanks for having me. Yeah, so in some states where virus restrictions have been more limited or business openings have been allowed for a longer period of time, we're seeing much lower unemployment rates versus states like California, New York, and Illinois, where unemployment rates remain extremely high and many businesses are either closed or at limited capacity.
Do you see areas change city by city, or is it mostly different by state or region?
It can also vastly differ by city, especially in states where there's a large geography. So, take California, for example. The Bay Area has had a very different unemployment rate and a very different economic recovery than a city like LA, which has a larger population as well as has had a lot faster virus spread and stricter restrictions.
Right. So it's this, as you described, this recovery, a patchwork of risks and rules. Why is that the case? Is it because of just the way the U.S. is set up with this federalism where states have rights and the federal government can't really put blanket rules and restrictions in place?
That's right. It's because the powers are delegated to the states, and on top of that, localities can set their own restrictions that are even go further than the state itself. And it also depends on whether the health department has power over the regulations versus a mayor. So in San Francisco, the health department can decide the restrictions, whereas if you look at a city like New York, Mayor de Blasio has a bit more control over what's going on there.
Well, you and your colleagues spoke to an infectious disease physician at Boston Medical Center who argued that one major problem when it comes to these lockdowns, when it comes to the economic and health consequences, is that they're reactive rather than proactive. What are some other ways that leaders could be more proactive so they're not reacting and the virus is already out of control and the economic costs are even greater?
Yeah, the public health expert we talked to mentioned offering support to both businesses and individuals ahead of time. So when they declare a lockdown, to say, hey, we're going to give you masks, we're going to make access to rapid testing available so that people actually abide by the rules. Because for some, even when there are restrictions, they still have to go to work, and the fear of spreading the virus increases, but also they just can't follow the rules because it's their livelihood versus the public health crisis.
When you look at the data that we're starting to get months and months into this pandemic, what is the correlation between COVID hotspots and where COVID-19 has really ravaged an area and the economic recovery that they're seeing? Is that clear at this point?
In some places, it's more clear than in others. So in Florida, cases have kind of remained consistent. They've seen a small uptick in the last month or so, but that state has been largely open. Versus in California, we've had some extremely strict restrictions and new ones being implemented early this month, but cases haven't really stopped their surge. And so sometimes health experts are saying that that's related to household gathering rather than actual spreading at businesses or out in public.
So after reporting this piece with your colleagues, what are the big takeaways for officials, local, state, and federal officials? I mean, what are the lessons learned almost a year into this pandemic?
Yeah, so sort of what the public health expert mentioned to us is it's all about, having conversations with businesses and politicians and health departments and working out creative ways where people can, avoid household gathering, but maybe gather outside instead, as well as, reacting to like small surges in advance rather than shutting everything down when cases are already spreading rapidly. But many say that the huge issue was that, there wasn't an early response as early as March. And so some of this is a little lost at this point.
Bloomberg's Olivia Rockman. Olivia, thanks as always for your time. It's great to see you
Thank you
this afternoon.
The biggest stories the moment they happen from around the globe. Subscribe to Bloomberg Quick Take now for insight in an instant.